The Idaho Meth Project was started as a response to really the devastating impact that meth was having on our state, its families, its businesses. At the time we started, it was a contributing cause for much of the crime in Idaho. Over half of county jail and prison inmates were there because of a meth-related offense. About 80% of child health and welfare foster home placements were related to meth. And it was really a burden on our state, not only socially, but financially. And after seeing the success of the Montana Meth Project, our governor felt that it was very important to bring this project to Idaho. Our objective is to reach teens and young adults in Idaho before they've ever had the opportunity to try meth. Our goal is to arm them with knowledge and provide them with the information they need to make an informed decision if and when they're given that opportunity to try this drug. Our target audience is teens ages 12 to 17, and our secondary audience is young adults 18 to 24. And really our focus is on prevention and the not even once message, which says if you can avoid this drug, you will have a better chance of success. You can go on to college, you can have a family, you can have a job. The rate of recovery from meth is about 10%. So that's why we feel that prevention and the not even once message is so important. Our whole approach is to unsell meth to teens, and we do this through our media campaign, which is graphic and raw and hard-hitting and created by award-winning filmmakers, and then also through our classroom education program. The reason that we're successful is that we're highly targeted, we're scalable, we're research-based, and we do one thing and we do it well. There are so many great organizations out there that try to be everything to everyone, and they have so many focal points. And for us, we feel like to be successful, we pick one audience, one topic, and we go at it hard, and that's why we're successful. The Idaho Meth Project is successful because we are a highly targeted, research-based organization that really brings in expertise from all over the state to create our campaigns and expand our community outreach programs. We have a wide range of local, state, and national supporters. We're part of a Meth Project family. There are 8 Meth Projects in the United States. So we all work together to maintain consistency in our messaging and share ideas and tailor our efforts to what works in each state. We also have a Teen Advisory Council of teenagers from all over the state that really gives us advice on how we're conducting our campaign and what can we do to improve. And they also do their own awareness and outreach activities in their schools and communities. So we really empower youth to get involved and say, hey, here's what works in my town. I'm going to help spread this message in a way that makes sense to us. We measure our success through quantitative studies relating to teen meth use. So since we started the project, teen meth use in Idaho has reduced by 50%. And in fact, all of the Meth Project states have seen similar reductions. So we know that this campaign is having an effect in our states. The drug issue is a supply and demand problem. And so if we can affect change in the demand sector, we know the supply will always be there, but if we can see the demand go down among our youth, then eventually we'll have more and more adults who aren't addicted to meth, they're not in prison for meth, their children aren't being taken away, and we're building a healthier Idaho long term. One of the most common misconceptions about our organization is that we are a short-term solution, and that because we've seen such great strides in reducing teen meth use in Idaho, we should just pack up and go home, which isn't true at all. We actually need to keep hitting this harder than ever, because with each year, there are kids becoming teens and teens becoming young adults, and they need to hear this message, and they need to have the knowledge about why meth is so dangerous. Another misconception is that people think we're a state agency because of the fact that our governor helped bring this project to Idaho. Governor Otter and his wife brought this to Idaho because they care about the state. And we are, in fact, a nonprofit organization. We do have to fundraise to continue doing our good work, and we do need the help of Idahoans to continue sharing the Not Even Once message with teens. Lastly, because of the scope and quality of our campaign, people are often surprised to hear that we are actually a very small organization with a tiny staff that works statewide to promote our campaign, educate teens, and really empower members of the community to get involved in our cause. So I always take it as a compliment when people say, "Oh, I thought you were so big and such a huge organization." And I'm just proud that we run a lean, mean machine, and we're very efficient, and we put out very high quality materials. Teens and young adults are a fickle and often hard to understand audience. So we measure our success by their attitudes and behaviors toward methamphetamine. And one of our greatest successes thus far is seeing a 50% reduction in teen meth use statewide, and that's according to the Centers for Disease Control. Another stat that we're very proud of is that 92% of teens surveyed by an outside firm out of New York City called GFK Roper said that they would want a friend or sibling to see one of our ads if they were thinking about trying meth. And what we've seen every year through doing these surveys is that we are moving the dial. More teens are seeing risk in using the drug, more teens are seeing our ads as effective, and less teens are using meth. One of our greatest challenges is also one of our greatest accomplishments, and that is that we've seen a great reduction in teen meth use in Idaho, and more teens are choosing not to use this drug, which to us says we're doing a great job, let's keep it up, rather than let's pack up and go home. With each year that goes by, there is another kid becoming a teenager, and we need to make sure that that teenager has the information to say not even once. Every dollar means more schools reached, more teens educated, and more health teachers given the materials to teach their classes on their own. And that's something that we hope to do more of in the future, is give these health teachers resources so that they can continue to educate their classrooms year after year about this topic. We've calculated that it costs approximately $3.55, only $3.55, to reach and teach one Idaho teen about methamphetamine. So really, a small amount goes a very long way in preventing teen meth use in Idaho. We're in a unique position in that we are in the schools educating kids on a regular basis. So in the future, it makes sense to us to possibly address some of the other substance abuse issues that are happening in that school or in that community while we're already there providing some crucial information. Another way we'd like to expand eventually is to provide some education to parents. They often come to us wanting to know, how do I tell if my child is using drugs? What are some warning signs? How do I get them help? And it makes sense to extend some of the knowledge that we have to parents in the future.